The purpose of the cast is to limit mobility of the soft tissue around the hip joint for patients with poor capsule structure or for those who have frequent dislocations after surgery. It is also used on patients with limited ability to follow hip precautions while healing, or patients who cannot adhere to wearing a brace. The cast is usually applied 2 to 3 days after surgery when the patient has the ability to stand 30 to 40 minutes and the wound is dry. If possible, allow the patient to shower prior to casting. If patient is unable to shower, a good sponge bath and skin care should be done by the nursing staff prior to application of the cast. Before casting, address the hip incision. The wound should be dry. If possible, sutures should be removed or well dressed and covered. If the sutures remain in, the cast should be changed and sutures removed in 10 to 12 days. Before casting, the patient should be hydrated. If casting within the 2 to 3 day postoperative period, the patient should have a bolus of 500 to 1,000 cc's of normal saline or lactated ringers, as it seems to help the patient's stamina for standing and enduring the cast application. Assemble everything before doing anything. You will need 8-inch to 12-inch tubular stockinette for the body, 6-inch tubular stockinette for the leg, 3-inch to 6-inch web roll for padding, moleskin and dense foam for padding and finishing edges, 8-inch to 10-inch Zimmer or Ace wrap to help laminate the cast at completion, scissors, tape, 1 washcloth for belly padding, water with straw for patient, blocks for leg positioning, tall chair or cross posts for end of bed overhead frame for patient to hold while standing up, towels, gloves, bucket of cool water, bedside table. You will also need assistance. You will need 1 person to dip the fiberglass rolls, 2 people to apply the cast, and 1 person to stand by and assist if patient becomes weak or needs to sit down. 4 people are needed for the initial cast application, but if the cast is being changed 2 to 3 weeks after the first application, only 2 or 3 people are needed as the patient's endurance is much better at this time. If the patient's endurance is poor and they need to sit down at any time during the cast application, they should be allowed to sit once the web roll is placed. Explain to the patient that once the fiberglass material is being applied, they will not be able to sit until the fiberglass is firm. After the fiberglass is firm, assist the patient back to bed. Let them know they should keep the cast uncovered for the first 24 hours as much as possible to allow for the water to evaporate. When changing the Hip Spica cast, the patient will usually be stronger and have better endurance. When changing the cast, give skin care and examine for pressure points. Give wound care and suture removal if necessary. When cutting your stockinette for the body and the leg, make the stockinette for the body about 8 inches longer than you need. This way you can cover the patient while they're being casted for privacy's sake. For the leg piece, make the stockinette approximately 6 inches longer than needed so you can overlap the body stocking and the leg piece. You can apply these stockinettes while the patient is still in bed to conserve the patient's energy that they're going to need for standing the duration of the cast application. Once the patient is standing, fold the washcloth in half twice and apply that piece to the patient's belly over the navel. This will give a little extra padding, so once the cast is finished, you can remove that belly piece and the patient will feel like they have room to breathe or eat. To position the leg, the patient should be in 40 degrees of flexion, 30 degrees of abduction, and 10 degrees of external rotation. Place the patient's foot on blocks to achieve these angles. Also, be sure to give extra padding around the low back and any area that has bony prominences. Use the web roll as a guideline to where the casting material will go, leaving about 1/2 inch. So as the web roll is turned back, there will be padding around all edges of the cast. For the knee, be sure to leave approximately 1 inch above the back of the knee to allow the patient room to bend the knee for sitting or standing. Leave clearance on the top of the thigh and around the crotch area for hygiene purposes, but keeping in mind that if you allow too much room, the cast will not have as much stability. Once the padding is in place, assess the patient. Do they need a drink of water? Do they need to sit momentarily? The patient will be able to endure the actual casting process if at this point they are refreshed. Next, apply the fiberglass. Once the fiberglass has been placed around the patient's body, pause for a minute and cut the stockinette so it can be rolled back and attached to the cast for a clean edge. Make sure there are no rough places or pieces of fiberglass that are sticking out and may rub against the patient's other leg and cause an abrasion. Use another roll of fiberglass to tack down the edges of the stockinette. Wrap a 8 to 10 inch piece of Zimmer wrap or Ace wrap around the cast, which will help laminate the fiberglass rolls. Have the patient remain standing until the fiberglass starts to set up and is hard. You can knock on the fiberglass and hear a hollow sound as the fiberglass gets hard. Once the fiberglass has set, you can remove the Ace wrap and help the patient back to bed. Also, remove the washcloth that was put in as the belly piece. Once the cast has been applied and is dry, the patient should have a post-cast x-ray taken to make sure that the hip is still in place. Please note, sometimes patients will complain that the cast is too loose. They will usually state this when they are laying in bed, because once they are laying down and the cast maintains its rigidity, the patient's abdomen will relax and they may even be able to place their whole hand into the belly part of the cast. This is quite normal. Do not change the cast or make it tighter, because when the patient stands up, the cast will fit as it should and limit their movement of the hip.